Hello, my name is Davi Kaur Khalsa, and I am a certified nurse midwife. I practice in Los Angeles, California, and I have a home birth practice. A midwife is a woman, usually a woman, that has had years of education, and she is educated in the area of prenatal care. She can attend births, whether it be home or hospital or birth center. There are two types of midwives in America. There are nurse midwives and non-nurse midwives. I'm a certified nurse midwife. That means that I was a nurse actually before I became a midwife, and which requires about 6 years of education, including midwifery training. In America, non-nurse midwives, which of course is legal, they're licensed midwives, they've had about, they're not nurses, they have had approximately about 3 years of education, perhaps more. They do more of an apprentice style where they get together with a senior midwife and a program of midwifery, and they do it together. So what a midwife learns is that a midwife can take care of a woman when she's pregnant, low-risk woman. And she nurtures her during her prenatal care, during labor and birth, and postpartum. A midwife also can do physical exams on women that are not pregnant, while women care, pap smears, menopause, perimenopause. Midwives can do a lot of education and provide care for many, many women that are considered low risk or well women. If it's a certified nurse midwife, she's gone through 4 years of school to become an RN and get her bachelor's or master's. And then she goes on for 2 or 3 years of midwifery school. If it's a licensed midwife, which means non-nurse midwife, she has, I would say, at least 3 years of education with a midwife in a program. Misconceptions about a midwife are that she is very rural, comes from a farm, comes with her, Birkenstock sandals, only eats granola, goes to a birth with maybe a little bag of herbs or, stuff. And misconceptions that I'm not sure how it began to be, looked at that way. Maybe because at the turn of the century in America, most births occurred at home with midwives. And we do know that the American Medical Association started a campaign to abolish midwifery, calling it quackery, identifying midwives as being very dirty and slovenly and inexperienced and uneducated. And that was a campaign that was very successful. By the 1940s, previous to that, majority of births were at home. By 1940, 90% of births occurred in the hospital. And that transition was quite brutal. Midwives are covered by insurance. Now, most midwives that work in the hospital, there are a number of hospitals in Los Angeles, California Hospital, downtown, Kaiser Hospitals, UCLA Hospital, where midwives work for the hospital. And they are covered 100%. California Hospital takes Medi-Cal. It's fabulous. Choosing a home birth or a birth center birth, nurse midwives and licensed midwives are both covered. That means they're not on the insurance plan. But with a PPO insurance, they will reimburse for home birth and birth center birth.